Hello everyone, welcome back to my YouTube channel, The Zone of Anatomy, and today we are going to discuss about the topic diabetes. So let's question, what is diabetes? The diabetes is a result of group of metabolic disorders. Metabolic disorders can be by carbohydrates, fats, protein metabolism. These disorders we'll broadly see in our biochemistry chapter. So basically the diabetes is caused by the group of metabolic disorders. Now, diabetes is caused by high blood glucose level. Before understanding what is the high blood glucose level, first we need to clear ourselves that what is the normal blood glucose level and what is abnormal blood glucose level. When we talk about normal blood glucose level, so the normal blood glucose level is 80 to 100 mg per dl, in which you might get a MCQ. Then we talk about what is abnormal high blood glucose level. It is the condition in which we have pre-diabetic phase and a diabetic phase. Pre-diabetic phase has a range 100 to 125 mg per dl. What is pre-diabetic phase? As we all know, any disease take a time to show its symptoms, and it gives indication, like body gives some indication to ourselves that it might contain some diseases. So the pre-diabetic is a phase where a person is not completely diabetic, but it might get a chance to go in that phase. So the pre-diabetic phase is from 100 to 125 mg per dl, and the diabetic phase when the person is at the last stage, and that stage is known as 125 mg per dl. So you get question on these three values which you have to memorize. Now, when we talk about the symptoms and the complications, so normally we see in the diabetic patient, then they have a repeated or frequently urination, and mostly at the night it happens, and the condition is known as polyuria. Since we are a medical students, we must know the medical terms and not the layman language. So it has a repeated urination or polyuria. The patient has a blurry vision. Then the patient has increased its thirst. So it is known as polydipsia, and the appetite, that is the urge of hunger, like the person start overeating. So the condition is known as a polyphagia. So the complicated symptoms or the symptoms which we see in the beginning, that is not severe or acute, that symptoms is known as that symptoms are polyuria, polydipsia, polyphagia, and the blurry vision. Then severe symptoms when the diabetes persists for a longer period, then the severe symptoms or the condition occur, and these can be a stroke, cardiovascular diseases, foot ulcers, damage to the nerves, and these all symptoms ultimately lead to the death. So therefore, we always say it is better to cure diabetes in its pre-diabetic phase. Coming to the hormone responsible for such condition is the insulin, and from where the insulin is secreted is it is from the beta cells of pancreas. So the MCQ which can be made is the insulin is secreted by beta cells of pancreas. Now, if there is a problem with insulin, so the insulin can play two controversies. Like one, the insulin might get insufficient, or the body cannot use insulin properly. So the two conditions which can cause this condition: first, insufficient production of insulin, or the body cannot use insulin properly. So in diabetes, this condition occurs. Now, what is the role of insulin? Insulin is very important hormone because it takes glucose from the bloodstream to enter the body cells where it is used for the energy. Then we come to the types. There are two types of insulin. Actually, there is total 7 types of insulin, but we normally study only 2 types of insulin. First is insulin dependent, or we call it as a diabetes mellitus, and the type 2 insulin resistance or diabetes insipidus. The common one is type 1 that we already see in our day-to-day life amongst our neighbor or the family members, and the insulin resistant is very rare. Now, type 1, we are in this table we are seeing just a superficial part of the diabetes and not the deep details about them. So first, the type 1, the important thing which we need to remember is that it is also known as juvenile diabetes. Why it is known as juvenile diabetes? Because it persists in our early age and not in the older. Like it might be in the older age, but it starts in the early age. Then there is the failure of the pancreas to produce enough insulin due to the loss of beta cells. As I already said, that the beta cells of the pancreas secrete insulin, and the problem might be insufficient production of insulin. So this type 1 is caused by that. Then its cure is the patient might take the insulin injections, and the patient experience diabetic ketoacidosis. Just remember, type 1 of diabetes produces or show diabetic ketoacidosis and not the type 2. So this might become your MCQ also. So coming to type 2 diabetes, it is also known as adult onset diabetes because it normally starts at the older age. So it is named as adult onset diabetes. In this, there is a lack of insulin, and it is therefore it is also known as the insulin resistant. And in this, the medication which we give is the oral anti-diabetic medication to the patient, and the caution which we need to take in this diabetic patient is first we have to maintain the blood pressure, or we must know that the patient blood pressure must be under the control, and the eye and the foot must be care, as the eye and the foot get the ulcers and the eye gets a weak during this diabetes phase. So these cautions which we have to take. Coming to elaborated form or the detailed description of the diabetes mellitus or the type 1 or the insulin dependent diabetes, first we study about the pathophysiology. As I've already explained in the previous slide, it is an autoimmune. What does this autoimmune means? It means when the immune cells of our cells of our immune system start destructing its own immune system. So autoimmune destruction of insulin, which is produced by what cells? Beta cells, and beta cells is present in where? Pancreas and in islets of Langerhans, and it is caused the insulin deficiency. The age, as I already said, it is a sudden and it is persists at the earliest, like 4 to 6 years old or 10 to 14 years old, where we start getting symptoms of type 1 deficiency. The risk factors can be genetic or the experimental. If anyone in your family is having the diabetes, so there might be a chances that you get the diabetes. And so the risk factors can be genetic and environmental, and when these both factors come together, then a patient experience or get the diabetes. Now, when we go to the clinical presentation, as we have already discussed, that it has a polyuria, that is increased urine glucose excretion, that in our urine the glucose start excreting, then the polydipsia and the polyphagia, which we have already discussed in the previous slide, and the diabetic ketoacidosis. Again, I'm saying in type 1 diabetes mellitus, the diabetic ketoacidosis is the main clinical presentation, and it is a main point. In our second part of the diabetes, I'm going to explain the detail of this diabetic ketoacidosis. Then coming to the acute complication of the severe complications can be hypoglycemia due to insulin and the diabetic ketoacidosis. Again, coming to its screening, basically the screening is when the patient goes to a doctor. So check for, like a patient is going to check for these features, and when he or she have to start, and at what frequency or at what time period he or she needs to visit the doctor. So this screening chart is going to tell us that. First is glycemic control. Glycemic control is hemoglobin test, which we use to do for the diabetic patient. So the screening test start when we first visit the doctor, and we need to do a diabetic or the hemoglobin test or A1C test in every 3 months. Then we have autoimmune thyroid, or TSH or TPO, starting with the doctor, and it is also frequency is 3 years. Like it is very much as compared to the glycemic control. Then we come to nephropathy. At the age of 15, by the age of 15, we need to see the doctor, and the frequency is annually. Retinopathy means retina, concern with our eyes, age up to 15 and doctor, and annually, and neuropathy annually and at the doctor. And when hypertension is something like very common outcome of diabetes these days. So hypertension, at the time of hypertension, we normally visit a doctors, and in every 6 months we need to visit again and again, and the doctor prescribe a psychologist or psychiatrist as our symptoms show. Then long-term complications, if we talk about the long-term complication, then we broadly see it into two parts, microvascular and the macrovascular. Microvascular can be diabetic neuropathy, peripheral and autonomic neuropathy, and the diabetic retinopathy. Okay. Then coming to the macrovascular diseases. What are the macrovascular? Let me explain you this peripheral and autonomic neuropathy. Basically, the peripheral neuropathy is concerned with the weakness or numbness and pains, and it is caused due to damage in our nerves. In the starting of the lecture only, I have mentioned that the severe complications or the acute symptoms may result in the damage of the nerve. So it can cause this peripheral neuropathy. And another name of peripheral neuropathy is peripheral neuritis. Then we come to a macrovascular diseases. It can be a cardiac disease, it can be a peripheral vascular diseases, and the cerebrovascular diseases. So let's discuss what is this peripheral vascular disease. The peripheral vascular disease is the condition of our circulatory system in which the blood vessels reduces the blood flow to the limb because it gets narrow. Like basically our vessels get narrow in this peripheral vascular diseases. Coming to the management, like how to manage, like how we can prevent diabetes. We can do it by two parts. Like we can educate a person or a patient or its family, or we can give the insulin management or insulin doses. So in education, we can train the family and the patient's family. Then we can educate dietitian referral, like dietitian gives a complete diet chart to the patient, what to eat and not to eat, and the carbohydrates counting, the how much carbohydrates a person need to intake per day, and it was made by a dietitian itself. Coming to the insulin, so insulin this can be given subcutaneous insulin infusions or the multi-daily injections. You might have seen some patient taking the injections on the daily basis, and that too in subcutaneous part like under the skin. Then continuous glucose monitoring, those who have this type of diabetes, you see that they have usually monitoring their glucose like fat in the fat state or the fasting state. Then there is hypoglycemic management, like to maintain the insulin level, they need to monitor each and every time. So now coming to the type 2 diabetes, it's like it is almost similar to the type 1 diabetes, like the symptoms and prevention, but few points are differ from type 1 diabetes that make it totally different. Like first, it is known as adult onset diabetes. It is known as because it start at the older age and not like in the very younger age. Then coming to its feature, again, it is having a high blood glucose, therefore it is named as diabetes. It is insulin resistant. We have already seen why it is known as insulin resistance, because it is not responding to the insulin. Then in this, the main important point is first this old age one, and then in type 2 diabetes, a patient has the obesity. That this point only distinguish the type 1 and the type 2. The obesity distinguish type 1 diabetes and type 2 diabetes very easily. Common symptoms can be polydipsia, polyuria, bloody version, and all the common symptoms which we have already seen in type 1 diabetes. Then the severe condition are same as we see in the type 1 diabetes, that is stroke, cardiovascular diseases, foot ulcers, damage to nerves, and ultimately, if it is not cured or it is not managed properly, a patient leads to a death. And it can be prevented. The prevention is different. First is weight management. Why weight management? Because we have the obesity. The patient is having obesity in this diabetes, and the dietary management. All obviously, the dietary is our priority in the diabetes. So guys, that's all from my side in this topic, diabetes. So basically, we just need to remember two things, that the diabetes is of two types, type 1 and type 2, and the type 1 is in the younger age and the type 2 is in the older age. The type 1 has the diabetic ketoacidosis as its clinical, and the type 2 diabetes has its obesity. These are the main key features that the examiner asks continuously, or in a past examination also. Just focus on the MCQs, and this is the only content you can mug up, and that is sufficient for you to understand. If you like the content of my video, do like, subscribe, share, and comment your reviews. And any topic you want me to make videos, just put the topics in the comment section. Thank you for supporting me. Bye.